podcast with our host, Tom Quigley of ClaimLinx. Tom, what's going on? How are you?
I'm well. Yourself?
I am finally recovering from a little bit of a flu, and it shows that even the media giant isn't bulletproof. All right, so today's topic is the gap plan strategy. 6 discovery questions. So we're going to talk about the gap plans strategy, which I have no idea about. And so this is going to be very interesting. So let's talk about it. First of all, what is the premium plateau and why is that so important?
All you're doing with the gap plan is covering the risk between a certain deductible amount with the primary insurance to another out-of-pocket maximum. So all you're trying to do is cover that. And what agents are trying to do is sell insurance products to cover it. Where I'm showing people just use your medical expense reimbursement plan where you don't have to pay extra premiums for and cover it. And it's a much better and easier way to do it versus having 2 different insurances and then there's gaps inside the gaps. Now the gap insurance, some of the products that you can purchase, you probably should on your own, like cancer plans, critical illness, accident plans. They're good stuff, but they're not going to cover everything. So the key is, do you want to pay extra premium to the insurance company to cover it? Or do you want to do the math, save the money, purchase gap insurance to cover some of it? Or you can say, no, I'm going to do it myself because why do I want to give extra premium away? It doesn't make sense.
So basically what you're saying is gap insurance is not a good idea.
It's not meant to cover everything that the major medic doesn't cover. And a lot of times you got to piece it together with 3 or 4 different policies. Sometimes there's one, that take away the outpatient, the inpatient, those risks. But the cleanest way to do it is through a medical expense reimbursement plan or a health reimbursement arrangement and agree to cover it tax-free if they use it. That way you don't pay extra insurance premium to the major medical carrier and you don't to the gap.
That makes sense. All right. So regarding the deductible dilemma, traditional high deductible plans save the company money on premiums, but they often shift the financial burden to the employee. Have you calculated the potential impact on an employee retention if their out-of-pocket costs continue to rise?
That's what most people are doing. The hedge inflation is going to higher and higher deductibles each year, but they're not buying the right plans. You actually want the lowest cost option the insurance company gives you and allow your employees to go elsewhere if they can get it, but you can cover them all through the same benefits through a medical expense reimbursement plan and pay a lot less money than what you're giving the insurance company to manage that risk.
Okay. If you are, so let's talk about the unused premium and audits. If your current fully insured model, if your employees have incredible healthy year and file few claims, who keeps the profit from those unused premiums, your company or the insurance carrier?
If you have a medical expense plan, you as the employer do on the premium that you would have paid before if you had kept everyone on the old plans. The insurance company, however, is making millions and upon millions by overcharging that risk.
So I see what you're saying. So it could be either or who keeps it, depending on who's smart enough and working with the right person. Get it?
If you do the math, if you're given the right formula, that's probably the best way because no one understands the garbage that is being sent to them. They quickly come to my way of thinking because it's basic.
All right. The mathematical wrap. This is interesting. If you could show a way to buy a Brown's level high deductible plan to lower your fixed costs, but use gap plan to effectively give your employees platinum level coverage, would your CFO be more interested in tax savings or the improved recruitment edge? And this is where you're going to be a little bit on a different direction. I have a feeling on that answer.
With what we're doing, you are giving them platinum plus plans. The whole idea is to use a medical expense reimbursement plan to cover that, to give the employees better benefits. The gap insurance that you're alluding to, again, you got to pay a premium for it. So the question is it cheaper to finance that versus paying for health insurance costs to the carrier? Or is the self-funded route with the medical expense reimbursement plan is by far the best because you're designing them yourself, which none of these others have the flexibility of doing so.
All right. Let's talk about claims transparency. You currently have access to line item data showing exactly where your healthcare dollars are going? Or are you essentially writing a blank check to your carrier every month based on the black box renewal formula?
They're currently, when I meet them, they're doing exactly what you just said. They're just writing a check and good luck. With what we're doing, at least they know how many emergency room visits and where they're utilizing their health insurance, because we're managing that piece.
And they're not showing that to if it's the other way.
Insurance carriers don't show anything, because if they did, they would be able to rip you off, because the smarter consumers would be going, wait a minute, why are you trying to raise us 22% when we had no claim?
Ridiculously. Oh, we don't want to talk about the thieves. The last top question I have is, in the 2026 strategy shift, most companies wait until 30 days before renewal to look at options. If you could decouple your benefit strategy from your standard calendar day, how much more control would you have over your Q4 budget?
If you understood you can do this stuff anytime during the year versus having to wait to renewal or the rip-off period, you would be far better off, because you don't need to follow what the insurance agents are telling you to do. They want to wait till the last minute, because then you have no options and you sign with them and they think they have you for a year. The reality is you control that piece.
Yep. Okay. Best place to go is ClaimLinx.com. I didn't really know about gap insurance. We got to learn that today. And then also, you can schedule a call with Tom today. Appreciate it, Tom.
Thank you.
That was the special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast, guys.